Hi everyone, welcome back to your second video of this week lecture. So in this video, we're gonna discuss on the drug clearance as well as the elimination half-life. So the major modes of drug clearance are the biotransformation to inactive metabolites by the liver enzyme that went through the phase 1 and phase 2 metabolisms. So this procedure or this process known as hepatic clearance. Besides that, some of drugs also can be excreted via the kidney or known as renal clearance. So kidneys will filter the unchanged drugs or metabolites into the bladder. So let's say increase the renal flow of the blood in the kidney will increase the clearance of the drugs. So for those who has the renal failure, which means that they have decreased the ability to filter the drugs, which will cause decrease the clearance. So there will be some changes in the dosing, especially to those who has the renal failure and underwent to hemodialysis. So the hepatic clearance can be reduced by the drugs ionizations. The ionization of drugs can limit the penetration of drugs into the hepatocytes. These hepatocytes are important as a site of metabolism, so which later will affect on the lead metabolisms and will prolong the duration of actions of that particular drugs. Besides that, this hepatic clearance also can be reduced by those drug interactions, which will be discussed later on next week. So the competitions between drugs or for metabolism or for transportation into the bile can affect the hepatic clearance. Beside to those who have the liver disease, especially alcohol intake or hepatitis, so also can affect the hepatic clearance of any drugs. It also can be happen to those who are poor metabolisms due to the genetic variations in drug metabolism enzymes. The hepatic clearance also can be increased by the induction of liver enzyme by same drugs or by another drugs due to the drug-drug interactions that cause the cytochrome to be induced or be enhanced by the environmental chemicals. Besides that, to those who has the ultra-rapid metabolisms due to the any genetic variations in the drug metabolism enzyme also can increase the hepatic clearance. The renal clearance can be reduced by the reabsorption of lipophilic drugs from the renal tubule to the bloodstream again. Besides that, it also can be reduced by the competitions between drugs for excretions, for secretions by transport system in the proximal tubules. It also can be reduced by the renal disease, which this disease will decrease the glomerular filtrations as well as the tubular secretion of the drugs. Alright, so let's move on to the elimination half-life before you're having a short break. So elimination half-life is the time required to eliminate half of the drugs from your body. Beforehand, you need to know the differences between the first order kinetics as well as the zero order kinetics. The easiest way to do that by looking at the graph here. So pay attention to the axis of this graph. The y-axis is the rate of drug metabolism and x-axis will be the plasma drug concentration. Before we go further, I would like to emphasize again, the elimination process is through the hepatic metabolism, which requires the hepatic metabolizing enzyme such as cytochrome P450. So these enzymes are located in the liver, waiting for the drugs to come in to biotransform into active or inactive metabolites. So I want you to keep this idea in the back of your head because it will help you to explain the differences between the first order kinetic as well as the zero order kinetics. So most of the drugs are going through the first order kinetics. Under certain circumstances, some of the drugs may enter to the zero order kinetics. Bear in mind that in first order kinetics, the rate of drug metabolism is proportional to the plasma drug concentrations. The idea here is, as increase in the plasma drug concentrations, we are putting more enzyme to work which further it will cause an increase in the rate of drug metabolism. At the zero order kinetic, all we are at the maximum or full capacity of the enzyme. There are no extra enzyme to put to work, and therefore there will be no increase in the rate of drug metabolism. And so when the drugs get to this point, what happens is that the rate of drug metabolism is now become independent to the drug concentration. Okay, so let's me recap it fast. As I move it to the right, when increasing the drug plasma concentrations, we expect the rate of drug metabolism to go up as well. So this is the first order kinetics that happen usually at the lower plasma drug concentration. And what you need to remember is, as I'm increasing the amount of the drugs getting into the liver, I'm recruiting more enzyme. As a result, the rate of drug metabolism is going up as well. And after this point here, we have maxed out all of our enzyme. And so, as the plasma drug concentration increases, as we move to the right on this graph, you should not see any increase in the rate of drug metabolism, and that is what we see here. So after this, the plasma drug concentration from here to here, we are at zero order kinetics, or known as zero order elimination. So this is the problematic. We don't like to be in zero order kinetic range. The reason is because these drugs will build up in the body, which leads to toxicity or any adverse reaction of the drugs or any unwanted effects to the patients. So let's discuss in further on the first order kinetics. So first order kinetics, or also known as linear kinetics, as I mentioned before, is a constant proportion either in percentage or in the fraction form of the drug can be eliminated per unit time. As example, a drug Y, initial dose is 80 milligram and has half-life of 1 hour. It means that after 1 hour, the concentration or the dose of 80 milligram can be reduced to 40 milligram, and after followed 1 hour, it will be reduced up to 20 milligram, and so on. So this value can be plotted in this chart, as you can see in this right graph here. So the y-axis is the unit of the drugs and the x-axis in the time. So initially at 0 hour, initially the drugs is available in our body about 80 milligram. After 1 hour, it reduced to 40 milligram and can be further reduced to 20 milligram. And the elimination half-life, or T half, can be calculated using these equations. For zero order kinetics, or known as nonlinear kinetics, or sometimes people call it as saturation kinetic, is the constant amount. The amount can be in terms of mass, or the amount sometimes people refer is number of moles of the drugs can be eliminated per unit of time. As example, drug Y, initial dose is 80 milligram, has clearance of 10 milligram per hour. It means that after 1 hour from 80 milligram, it reduced to 70 milligram, and after 1 hour, it can be reduced to the 60 milligram and follow up. And this data can be plotted as shown in this chart. Let's move on to look one of the examples here. A patient was given a 200 milligram of dose of drug IV, and 100 milligram was eliminated during the first 2 hours. If the drugs followed the first order elimination kinetics, how much of the drug will remain 6 hours after its administrations? So when you can see in these equations here, it took 2 hours to cause the 200 milligram of drug being transformed into 100 milligram. So means that the half-life of this drug IV is 2 hours. So as you can see in this diagram, drug IV initial dose is 200 milligram and half-life about 2 hours. Means that after 2 hours, it causes 100 milligram drugs available in the body, and followed by 50 milligram another 2 hour, and another 2 hour it will be reduced to 25 milligram. So the answer will be 25 milligrams of drugs available in the body after 6 hours is administrations. Alright, let's move on to the second examples. So at 6 hours after IV administration of bolus dose, the plasma level of drug is 5 milligram per liter. If the volume of distribution is 10 liter, or known as the VD, is 10 liter, and the elimination half-life, which is the T half, is 3 hours, what was the dose administered? So they required you to calculate the dose administered. So the data that you found from these questions is the plasma concentration after 6 hours, which is the 5 milligram per liter. So it means that you need to recalculate, reverse back to calculate the initial plasma concentration at the top, at the point time given the drugs. So using this data, you manage to calculate 20 milligram per liter. So using this data to calculate the amount of drug in the body, it is because amount of the drug in the body is equal to the IV dose administered. So once the dose be administered intravenously, it will be 100% available in your bloodstream. So amount of drug in the body equal to the dose administered. So to calculate the dose administered, you need to time the volume of distribution with the concentration of drug in the plasma, which is the 10 liter times with 20 milligram per liter. So you manage to get 200 milligram.